Okay. I'm gonna be reading something I typed up. I typed this up on Saturday, but what was it? Yesterday, I had a little experience, I guess I could say, that reminded me of the fact that I typed this up and was supposed to make a video about it. And what happened the other day was that I was at this cathedral warming shelter type place. Well, I've kind of been there for like some days now, but yesterday some nurses had ended up coming out there to talk to whoever wanted to talk to them. And one of the staff members had told them to talk to me and told me that the nurses were there because she remembered that on my first or second day I asked them something about, I think, getting a bus pass so I could go to the nearest CVS because I needed some more Lancets for my Accucheck because I had ran out of Lancets like some days ago. And if you remember, I made a video, like, this was a little while ago, about how I decided to get an Accucheck because somebody, well, I made this post somewhere about, like, my blood sugar and how, since I was working on my health, I really wanted to get to the bottom of things and find out if I still had insulin resistance going on and if that could also be another part of my issues. Because as you know, the drugs that you're forced on in the Cash for Kids system give you what they tell you is quote unquote weight gain, but really the drugs are giving you brain damage, which turns off neurotransmitters that make the body work, which screws up your health. They also damage organs. And so they're giving you metabolic syndrome slash type 2 diabetes and heart failure. And so, yeah, they give you diabetes, but commonly doctors won't actually diagnose you with diabetes. They'll just either ignore everything or they'll constantly tell you about how high your A1C is, how high your blood pressure is, how high your glucose levels are, and things like that. But they won't give you a diagnosis, especially if you're in the Cash for Kids system. They commonly won't actually tell you you have diabetes, and they may not even tell you about how crazy your blood work comes back. But what was I getting at? So yeah, I started doing research on diabetes and then I found out about type 1 diabetes. And of course, I don't claim any of these different little labels and these diseases, but I definitely did find out that I was totally still insulin resistant and that I actually had went from type 2 territory to type 1, which is why I dropped down to 80 pounds at 14 after getting off the drugs because the drugs had damaged my pancreas, liver, kidneys, and etc. so bad, which is also why I used to have the pelvic floor dysfunction that I would talk about on like the part 2 and part 3 channel, and some other issues because of mold toxicity in the house. But I got more sick than any of my relatives did because my liver and stuff was already functioning low, and so I wasn't able to filter it out like my relatives were, and that's why I got as sick as I did. Not to mention, I'm pretty sure I had COVID twice. But that's kind of a side thing. So, anyway, what was I getting at? I'm trying to remember what I was getting at because I was trying to like summarize everything, but I don't really remember. Okay, so yeah, there was that. Oh, yeah, so anyway, I was just told that like since I was wondering if I was still having low or high blood sugars, because I remember that after the whole drugging thing has stopped, 16 is when the whole thing happened where I moved to GA with relatives. And that's when doctors finally asked why in the world I was 80 pounds. This was a little before I left, too. So this was 16. And doctors were finally like, why are you 80 pounds? Because I was still living in NC, which I'm back there as of right now visiting. But I was still living in North Carolina then. And none of the doctors, when I would go to the doctor, the little 1, 2 times I did go, none of them asked anything about that and about why I was 80 pounds, because of course they don't care. But GA they did, but they didn't really do a lot of testing, I guess, or they just didn't care. So they knew I was in an abuse situation and a Munchausen situation. So as I mentioned before in other videos, they just said that they felt like I was being starved at home. My mom was like starving me and then bringing me to the doctor and saying she didn't know what was going on. But actually, all the symptoms I was talking about at that time are from the mold toxicity. But yeah, so they had told me about how low my blood sugar was, because when I was on the drugs, I used to have the high A1C and high glucose levels and all those things and the high blood pressure. But then when I dropped down to 80 pounds and then at 14, and when I went to these doctors in GA at 16, I was underweight, severely underweight. I still am because I can't gain weight. And I had the low blood sugar, and that, what was I about to say? Yeah, so I guess that's the summary because I don't really remember what else I was supposed to say. And so the other day, to circle back around to the things with the nurses yesterday, since one of the staff members from the Cathedral Warming Shelter had told the nurses about me needing more lancets, which I actually had been got some more lancets because one of the staff members had got some more for me. They thought that I was like a diagnosed diabetic, and I was like, no, I don't have a diagnosis of diabetes. I just have low blood sugar. And of course, they tried to do the whole, the look that doctors give you when they're trying to act like maybe you just have fictitious disorder, and like they started asking, what did a doctor say that? And I was like, I mean, yeah, that's what my blood tests have been coming back as for years, and that's what they were telling me. Just like how they were telling me the whole bunch of other things throughout the years. Which actually, like I've said before in other videos, my blood work is actually, it's been way better. Even before I started working on my health, just after like leaving my situation, I was able to like find this homeless doctor where I could just tell them I think I was telling them I was 19 or something like that, or 20, I don't know, but I was able to tell them that and then get blood work done, and that's how I was able to find out that for the first time in my life my iron levels were normal and I didn't have low red blood cells anymore. I was lied to and told that like they did testing for like what was it called, for my white blood cells, but they definitely didn't, because when I finally figured out that I could order my own test out of pocket from Quest and LabCorp, I found out that I definitely still have low leukocytes and neutrophils, which are white blood cells. But anyway, so of course the nurses did that little thing that medical professionals do, and then they asked if they could test my blood sugar, and it came back very low, 55, and then they looked scared. And it was actually kind of funny because commonly when I check it, it's lower than that. Like I remember one time some weeks back, I checked my blood sugar and it was 54. But yeah, so they were like, your blood sugars is this low and you don't have a diagnosis and aren't on any meds? And I was like, I mean, yeah, I don't want any of their diagnoses anyway. And then they were talking about some, what else did she say? Oh, yeah, she said something about this clinic that they have at some other cathedral that's like really far away. And honestly, I mean, I wouldn't mind doing the walk, but one, I don't live here and I don't have medical insurance here. And two, I wouldn't be able to find it. But yeah, so anywho, it's also the fact that I've already ordered tests myself out of pocket, and I don't really see a reason to get the same test I just got. The only test that they could give me that I haven't ordered myself and can't order myself for X-rays and what would I really? I think it would be an ultrasound or maybe an MRI, whichever one, maybe a CAT scan, whichever one will like get a picture of the pancreas and the liver and different things like that. That's the only thing that they could give me that I haven't got myself. Because I don't know, just the thought of like finally getting a, wait a minute. Finally being able to get tests that I asked for free when I've already paid hundreds of dollars for them. Well, for different tests that I needed for years, just annoys me. And I mean, the only reason that they would really want me to retest anyway, when I already have tests with paperwork of different things revolving around the issues I have going on, is because of the whole. Well, we don't really. Okay, wait a minute. I'm trying to figure out how to explain it. Pretty much like I said before, when it comes to the whole trying to get, I don't know, therapy for like cash for kid system abuse, they're not gonna want to believe. No, let me rephrase this. In their mind, I'm a medical professional and I would never medically gaslight somebody or know that somebody has all types of issues going on and not do anything or diagnose them. So I don't believe this happened. So I want you to do the same test you already did again, but have me do them so I can know for sure that you're not just lying about stuff, because I don't believe that we would do this to somebody. And if it wasn't for medical professionals, I wouldn't have the issues I have anyway. So it's all just really annoying. Not to mention, this is the same state, and probably even work for the same medical organization, I guess it would be called, like maybe Novine Health or Baptist. But this is the same state where the cash for kids system abuse started. So I can only even imagine what's even in my medical records here. Which, like I said, I couldn't even do any testing anywhere because I don't have medical insurance. But still, if I did and I did live here, once whatever in the world, because I can only imagine, once whatever in the world is in my medical records is seen by them, then everything just completely changes from a physical health appointment to like a psych visit, and then the whole subject is going to be changed to other bull crap. And like I said, throughout my cash for kid system abuse situation, I was told over 20 plus different labels, even things that aren't even really valid, like unspecified attention deficit hyperactivity disorder, which isn't even really a diagnosis. But well, actually, that was put on paper once, but I don't even know how much of the things my mom or her boyfriend would say were actually ever even put in a system somewhere. So it's like I can only imagine what's in my medical records, especially here in the state where all this stuff started happening. So it's like, I mean, the situation would just go really left. Kind of like this situation I actually had a video of and about back when I was still doing the evidence channels, where pretty much, to make a long story short, due to my health going downhill, I eventually got this tonsil infection called tonsillitis or tonsil stones or something like that. But it never went away, and I just had it for years on end. And then finally in GA, after my mom kind of like got scared because of some stuff with like people reporting this stuff with a social worker. Long story. She finally actually really talked the doctors into giving me surgery for it. And I wish I wouldn't have had to get the surgery. I don't like getting stuff removed, but I kind of had to because due to like the health stuff I've going on, my body wasn't able to get rid of it, the calcification, because that's what tonsil stones are. But anywho, so when that happened, I ended up having this what would I call it? I'm just gonna call it a mishap because I don't really remember the actual word for it. But pretty much, they started bleeding pretty bad and they weren't supposed to be bleeding. And so my mom wasn't even at home, but she wouldn't have took me to the doctor anyway. But my mom's boyfriend was like, just go lay back down. And they weren't supposed to be bleeding, just like the doctors had told me that it's not supposed to start bleeding. Definitely not like that. And so I figured out how to just like go to the doctor myself, and I snuck to the ER. And of course, what was it? What was I about to say? Oh my gosh. Hold up. Wait a minute. Oh yeah, due to the whole ageism stuff and the 18 laws, which they actually weren't supposed to even take me to the ER, but the what are they called? The EMS people were kind of nervous about like the fact that my throat was bleeding and it wasn't supposed to be, especially to the level that it was. So they just ended up taking me to the ER anyway. But I still had to just sit there for a while. And by the time they finally took me, my throat had actually stopped bleeding by then, or by the time I actually got in one of the emergency rooms or something like that. But yeah, so they of course had to call my mom and my mom's boyfriend, or it was something like that. Or maybe it was my sister that they called, but then she was like, well, I'm the sister, so just call my mom's boyfriend because my mom's at work or something like that. And of course, I got in trouble for going to the doctor. Because something that I forgot to say is that none of the issues I actually had ever mattered, mental or physical, which I used to talk about a lot on the evidence channels. So it's like they didn't want me to be seen for any issues I actually had, and I would have to beg to go to the doctor. But then, because of how the medical system is, when I finally would go to the doctor, also because the labels that would be told to them, they would just brush me off. Well, not brush me off. I mean, they didn't care anyway, to be honest. And at the end of the day, they don't cure anybody, which is another thing that I talk about a lot. But yeah, so I begged to go to the doctor and would be not allowed to go. And then when I finally would be allowed to go, they wouldn't do anything. Just like how I used to think that the mold toxicity was maybe UTIs that I was somehow getting. Because I did get one time before from being in this coma once. And I wasn't going to the bathroom because I couldn't. And so I had got a UTI and I was eventually actually taken to the doctor for that by my dad after a lot of begging, and then they gave me the meds for it because I did have a UTI. And so when I had the mold toxicity or the pelvic floor dysfunction from the mold toxicity, I was thinking maybe this is just like a UTI that's getting bad because I've had it so long. But my mom would never take me. And then the one time I finally did actually get taken, they didn't do any testing. And then my mom told them that I was autistic. And then they were like, oh, okay. And then, yeah. But they weren't about to do testing anyway because in this area that I was living in, this was in GA, a lot of kids around there were like really hypersexual due to being sexually abused. So because of that and sexism and different things like that, probably even some racial stuff was in there too. Doctors just would tell me stuff like, well, I feel like you're being molested at home, or you just need to stop having sex. And I remember this one doctor, nurse, or whatever tried to tell me I was pregnant with an STD. I don't even think I could get pregnant. And actually, if I told you guys that I hadn't had a period in like forever and a day, how in the world am I pregnant? But oh yeah, but I guess they thought I was pregnant. I don't know, not because I don't even really know how that works. So actually, now to think about it, I guess that's why I wasn't having a period in their eyes because I was pregnant. But that would take me somewhere else if I really go into that story, which I've talked about before. But yeah, anyhow, that's how it would go when I was finally taken to the doctor, and it was just really annoying. And so yeah, trying to remember what I was last at. Okay, don't really remember what I was getting at, but back to the ER thing. So my mom and her boyfriend were mad, and my boyfriend I mean, not my boyfriend, my mom's boyfriend had came up there, and he had told them that I was just schizoaffective, and then, or that's what we told them on the phone. And so then they had gave me this little rundown on how sneaking out the house is dangerous. All I did was go to the store beside the house and ask them to call the ambulance because I couldn't do it at the house because my mom's boyfriend was there and he would have gotten mad. And I don't even remember if I had a phone. Well, I probably did. I just had to hide my phone at that time. So then that would have been like another question is, how did you call the ambulance anyway? So yeah, there was that. And then I was in the ER for a couple of days though, And I didn't even find out that my mom's boyfriend had told me I was schizoaffective till days later. And now, mind you, I hadn't even heard that term in years. Usually, my mom would like say the autism thing, or she would say schizophrenia, but this time she didn't. They didn't say that. And then, or she would say like I don't know, I was a sociopath and a whole bunch of other stuff. Or she would say ADHD or ODD. I'm honestly surprised they didn't use the ODD label in this situation, because they could say, well, she snuck out the house because she was ODD. And it's like, I snuck out the house, quote unquote, because I was beside the house, but I snuck out the house to go to the ER. They were acting like I don't know, went to the club or something. But yeah, so, um, yeah, I was in the ER for like a couple days, or, well, no. I was transferred upstairs, and what was it? Oh yeah, they told me that like I just needed to eat some applesauce and stuff like that for a little while, and I was like, I don't really I don't really want to just eat applesauce, and I'd really rather eat something else, like some actual food, because I'm already severely underweight, and I didn't really want to lose weight because I was still 80. Well, honestly, I mean, I've been stuck at 80 pounds for a while because I can't gain weight, but I was like, I'm 80 pounds and I don't want to lose any more weight, if that was even really possible. And I was like, I really gotta like eat something other than applesauce and yogurt. And then one of the nurses or whatever in the world she was like, well, I mean, I don't think you're 80 pounds. You look a little bigger than that. Usually we have an eating disorder unit or a psych unit with people with eating disorders or something like that. And there people who are 80 pounds usually look smaller than you look. So you're fine. Or I think you weigh a little more than that. Something like, it was, yeah, that's pretty much what she said. And they were like, you just have to eat this for a couple of days because you can't start eating like real food yet. And so that happened, and then eventually, to make a long story short, I found out that my mom's boyfriend had told him I was schizoaffective when they called him, and they pretty much just thought that they didn't believe that my throat was really hurting as bad as I said it was. No, wait a minute. That's what had happened. Because I forgot something. My throat was hurting, and I couldn't swallow food yet because I told them that the pain meds weren't working. I'm starting to remember it more. And they didn't believe that the pain meds weren't working. They thought because my mom's boyfriend told them I was schizoaffective that I just wanted to take, what are those things called? Not opioids, but it was something else that kind of sounded like opioids, but it wasn't. But pretty much they thought that I was a schizoaffective drug addict that was starving myself and was lying about the pain meds not working. That's what happened. And I was like, I really need to take some pain meds that actually really work because I don't want to keep not being able to eat because I don't want to lose any more weight because I'm already severely underweight. That's what I had said. And then eventually they admitted to me that really your mom's boyfriend told us that you were schizoaffective and this one doctor had came and he was like, no, he told me that, and I was like, I don't even know what schizoaffective is. And he was like, well, it's this weird disorder. Well, not weird, but it's this strange disorder. And he was like, well, that doesn't sound too good either, but my grandma has it. And, it just means that you're a little different. And the usual stupid rundown that people give you. And I remember I made a post about this on some sub back when it happened. And somebody was like, isn't it funny how nice they get once they find out about some mental disorder that you supposedly have or do have? The sarcasm there was super funny because it is funny how nice they get. But yeah, so that happened, and then they were like, we don't really want to give you these drugs, and we just feel like, you just. Yeah, and so then they wouldn't let me get in the bathtub either because they felt like I was just gonna try to drown myself or something because I was a schizoaffective drug addict who was starving myself and was suicidal. And that is my summary of a whole. That's not even a summary. But that is one situation that happened where once a label was found out about, the whole appointment went from a physical health thing to a psych visit. And I even had nurses coming in there asking me like what day it was and what time it was, and I didn't I didn't even know how long I had been in there after a while because the days just started to blur together. And so yeah, that happened, and luckily there was a whiteboard behind the nurse that actually had the date on there, so I was able to tell them what date it was, because honestly I forgot after a while. And that's what happened, and I really just ended up regretting going, because like I said, by the time my throat stopped bleeding, by the time they finally were willing to take me to the ER, even with me being underage and not having parents' permission, my throat had stopped bleeding. But they did say that I ended up getting a blood clot from that, so they did actually look eventually after a while and say that. So that's also another reason why, even if I do have the chance of possibly getting like a diagnosis that can maybe help with what little housing programs there are that revolve around like physical disabilities, because I still can't get SSI because of the whole situation with my mom and the old labels, long story, but I wouldn't want that anyway. But the housing could maybe be helpful, but also commonly even with the disability housing you have to be like 60 plus. But my point is, even if me going to this clinic could help me finally actually get a diagnosis revolving around my physical health put on paper, like actually put on paper, which could help possibly with like disability housing, I still know that because this is the state where the Munchausen Cash for Kids system stuff started, there's going to be so much bullcrap in my medical records that the whole situation could really just go left. Like, for one, since I'm homeless now, they could be trying to figure out how to put this. They could try to make it like, well, really, your health just got bad because you haven't been like taking care of your health because you've been homeless, and because you're homeless, you're also like insane and on drugs, and so you've probably been doing drugs that messed up your kidneys and pancreas and liver and stuff, and you probably have been like, I don't know, neglecting your medical needs and not meeting with primary care physicians and stuff like that because you're homeless, because you're insane and on drugs, and that could happen. And even if they do a drug test and like nothing comes back because nothing will, because I don't do drugs, they could just say, well, maybe you were doing drugs at one point. Kind of like this situation where I guess because my symptoms mimic pancreatitis, this one doctor in Cali was like, "Are you sure you don't smoke cigarettes and never have?" And I was like, "Yeah." And I didn't know why he kept asking me that, but now I know it's probably because of like the fact that my symptoms mimic pancreatitis and a few other things, and probably some other reasons that he just didn't mention the test results for. Like, I don't know, maybe something with like getting my what's it called, blood pressure checked. Because, like, I think smoking could affect that too, but I don't know. That was my idea of why he kept asking me that. And then, what was the other thing? Oh, yeah, then the fact that, due to the fact that I got sick because of iatrogenic effects, if all the things that could possibly pop up in my medical records don't pop up, or whatever happens with that, or they just don't see it, I don't know. I still can't, like, actually talk about why I actually got sick because, once you mention psych drugs, then they start asking about that, and then this appointment will turn from a physical health thing to a psych evaluation or a psych visit or whatever. It's like, just like with law enforcement, you really can't win with these people. They always have to find a way to like point fingers back at you. And of course, medical professionals already feel they're already really gaslighting. They're already gonna feel like, well, we have to find some way to change this around because I refuse to actually accept or admit the fact that you've been walking around with this um, physical issue for all these years and have just been getting uh, played with by doctors, even though your test results and blood work would always come back really crazy. Because it really would. I remember doctors would like look scared after my blood work, like especially at 16. They came in the room looking terrified, and that would commonly happen. And it's like, I don't know, just like when you're on the drugs, they never actually tell you about how, well, even when you're not on like psych drugs or in the Cash for Kids system, even when you just have diabetes just because of like the stuff that's in the food or maybe your diet, they never actually tell people how dangerous diabetes actually is and what diabetes actually is or actually does to your health. Like, I was never told that having high blood pressure and high blood sugar and all the other, oh my gosh, the place crack, all the other different stuff I had going on would affect my health. I hope that came out right. And then when my blood sugar became low and like my weight dropped, I was never told how much having low blood sugar could affect your health and what that actually would do. Like, I now know that honestly the reason I stopped digesting food is most likely because of the fact that diabetes and blood sugar, out of control blood sugar, breaks down your organism, breaks down like how your body works more than the brain damage and the turning off of neurotransmitters. Well, not more than, I could say probably just as much or maybe more than, but I don't know. But either way, that's what diabetes does. And then my blood sugars would be so low and even so high at some points in times that my body couldn't really function. And so now I know that that's actually the reason I stopped being able to digest food at 15, which I've been working on. And it's better now because I've been taking the digestive aids, which goes into another thing because they may want to know, like, kind of like they were already wondering, if you're not on any meds and you don't even have a diagnosis, how in the world have you been managing your health when your blood sugar is 55 and even lower than that sometimes? And so then if I was to mention the fact that I started taking betaine HCl and the enzymes, and they could be like, well, it sounds like maybe your kidney function just got bad and your liver function just got bad because you're taking a whole bunch of drugs you don't need to take, which then that would go back to the fictitious disorder accusations that they love to give in situations like this where you've been medically gaslit, but they won't even admit that something happened, even though they aren't even the ones that did it. Because, I mean, they could just be like, I mean, it happened and they did that to you, but it doesn't have anything to do with me. But instead, because of how medical professionals are and even how law enforcement are, because like I said, they're just alike, they would be like, well, I wouldn't even want to admit that people in my field do the things that they do, so I'd rather just tell you that you're lying in general. And hopefully this all makes sense, but it's like, I just know how medical professionals are and how they operate and how they work and how their manipulation is, and it's like you can't really win regardless, just like with law enforcement. They always have to find a way to point fingers back at you somehow and to make it about you or something you did. And I forgot to mention that they of course had asked me like, well, I mean, have you eaten anything today? And I mean, yes, I've eaten something multiple times today because I have to eat like 30 plus times a day because my blood sugar is constantly dropping. And honestly, it's gotten worse since I've been back on the East Coast because one, the crap that's in the food, but two, the stuff I've been having to eat, which is just a whole bunch of carbs and stuff. So it's actually gotten worse, I feel. And of course, it gets worse on the Greyhound because, like, I'm not able to eat hundreds of times on the Greyhound. So I was having all types of hypoglycemic crashes over and over again. And honestly, I feel like now that I know what I know, that even happened when I originally went to Cali, when I originally escaped my previous situation. I was having hypoglycemic crashes as I now know them to be all throughout that what was that? I don't know, 7-day bus trip. But yeah, so she tried to do the whole, well, maybe you just haven't eaten enough thing, and like, are you eating enough since you're homeless? And that's another thing too. It's like whatever situation you're in, or at least how it's been for me. They try to make everything about my situation. Like when the mental labels were in the system in NC and GA, they were like, well, I mean, you're just like handicapped and retarded, and I mean, you're slow, so maybe you just, I don't know. And then when it comes to like labels other than like I don't know, the autism or the ADHD, then like for the ODD, I don't even know how to really like make up a scenario of like how they think when it comes to the ODD, but like for the schizoaffective or schizophrenia or the quote unquote sociopath or whatever, which honestly ODD is a psychiatrist's way of saying that like a kid is a future sociopath, because like, oh, you're a bad black kid, just like with the bad black kid with ADHD label. It's really just another way of calling the kid a sociopath, because quote unquote you're bad, and since you're bad and you won't listen to your abusers and let people do whatever they want to you, you're antisocial and you hate rules. So they'll be like, well, you're just manipulative and delusional, and you want to pretend you have issues for attention. Kind of like how in the beginning of the Munchausen situation, I was told that I was just faking things at home to scare my mom, and that's why she was putting me in these TTIs and stuff. But yeah, anywho, as if they don't know the reason that me and the other kids are really there is because they get paid for it. But yeah, so there's that. They could just say you're attention seeking or you're just delusional. Which the medical professionals these days in general, they love to do that. They love to do the whole delusional thing. Just like how, as an example, if you have kidney issues or liver issues that cause you to be really itchy because of your body not being able to get rid of toxins how it's supposed to, the medical professionals these days or in the mainstream medical system will tell you, oh, you're just like paranoid or schizo or delusional, and you have delusional parasitosis because you think you're itchy, but really you just have kidney issues. And there's a lot I could say about that, but that's one example. And then what else is it? What was I getting at? Oh yeah, but to get to the point more, when I was in GA, the doctors know I was in an abuse situation, so they'll be like, well, maybe you're just like stressed out, and that's why your blood work comes back terrifying, and you're in pain and like throwing up all the time. Although I can't say I didn't really get to go to the doctor all that often, so a lot of my medical gaslighting came from relatives. Like I remember when I was still on the drugs and actually had diabetes type 2, my mom's boyfriend would like make these jokes and he'd be like, um, you're delusional, you think you have diabetes. And I had never once said that I thought I had diabetes, or I didn't even know about the metabolic syndrome at that point in time. I didn't even find all that out till like years later after getting off the drugs, because for one, they made me too dingy to really look into anything. The one thing I did know is that they were definitely turning off my bowels, so that's the one thing I did know. But now I know that the reason my mom's boyfriend would make those little manipulative jokes was because they knew I was walking around with very unmanaged diabetes from the drugs, which commonly when you get off the drugs it goes away, but for me, it just messed up my pancreas so bad I went from type 2 territory to type 1, which I now know. But yeah, so there was that. Also, my older neighbor sister would try to tell me that my mold toxicity symptoms, like my pelvic floor dysfunction, which would cause spastic colon and different things like that. She tried to tell me that and me throwing up all the time and like having diarrhea, which I was having diarrhea because I couldn't digest food. She tried, and because of blood sugar issues too, but she tried to tell me that was just anxiety, which I've honestly never had anxiety. And yeah, I just had serious health issues going on, which were way worse when I was living with relatives, especially because one, the abuse, two, the fact that I was in the mold toxicity, and the house also had high carbon monoxide, which is because of the mold and probably some other stuff with the HVAC system. But yeah, so there was that gaslighting, and then what else was it? Oh yeah, then in Cali, because I was homeless at that point in time. The doctors were trying to make all my health issues about me being homeless. Like, well, maybe you're insane, or not even really usually that. Really, the drug accusations that I possibly was just on drugs, or um, that I just wasn't eating enough because I was homeless. And then, of course, when my back had like started hurting really bad, because my back pain started in like August 2023, and then I still have it. It never went away, but the way it hurts has definitely changed up, and I still have like the little spinal lumps, more so in my lumbar, that sometimes swell up, which is what that chiropractor I mentioned before was feeling, that were really swollen when he like claimed I had degenerative disc disease. But I don't know how true that is. I'm starting to feel like whatever it is related to the blood sugar issues, or even my kidney issues. But of course, long unmanaged blood sugar issues and insulin resistance and diabetes can definitely cause degenerative disc disease and a lot of joint issues. But I don't really know how true that actually is, because it seems like the spine lumps that I have, especially in my lumbar, what's causing the pain, whatever they are, because I'm not really sure. But yeah, anyway, so when that happened, I mentioned this before, I went to the ER this one time to try to see if I could maybe get a MRI, because I already got an X-ray, which honestly may have been fake at the chiropractor. And surprisingly, the ER did give me an X-ray, but I didn't get to see the results, and they just tried to say, well, I mean, they look fine, because honestly, whatever I have probably would only be seen in an MRI or something. But is that what it's called? I think, is it called an MRI? I don't know, maybe a CAT scan. But of course, they did the usual. Well, you're just like a black female, and like, you just gotta. I've never even had sex with anybody, but the usual pregnant with STD accusation, maybe have an infection. But, and I also mentioned in the video I made about this that the lady was talking mad junk about me, and she didn't even know that I was like nearby, so she didn't know that I heard her. But she was talking mad junk about me. But yeah, so there was that. And it's all just really annoying. But like I said, I don't even do medical professionals, and at the end of the day, they don't treat anybody, so it's like there isn't really much of a point in like going to them about anything, because they're not trained to cure anybody. They don't even know what really causes these different issues, and the medical professionals that do know won't talk about it because they'll lose money, or they're not allowed to talk about it. And it's like the best thing I could do is like do a plant-based diet, which I've been wanting to do, but I haven't really been in the situation to do it. And the little bit of time I was living in that host home thing with that trifling vegan lady, I didn't end up doing it. And the one time I did try, though, I didn't know that like I needed to have less sugary fruit, so it just didn't go right. And I didn't have a fridge the first time I tried, but that second time when I was in the host home, because I think I did try. I don't remember what happened. I don't know. When you have like blood sugar issues, you just get hangry and have like craving issues, and I just couldn't really do it because it just wasn't what I really wanted to eat. I'm not even gonna lie. And that's the thing though. When I was doing research, I seen that like blood sugar drops or hypoglycemia is caused by eating food that causes spikes. But the thing is though, when I do check my blood sugar, I never I've never seen any spikes. I've never seen my blood sugar be any higher than it's supposed to be. It just looks like I have issues with hypoglycemia, which I guess is how type 1 works, I guess. I don't know, but I've never seen it be any higher than it's supposed to be. So I don't really see the whole I'm having crashes because I'm having spikes thing. As people, well, as medical professionals say it goes, I don't really see that, at least with myself. But one thing I can say though is that it definitely has gotten worse since I've been on the East Coast, I feel. But then again, I don't even know if that's true, because something I noticed is once I realize something, or kind of like, okay, wait a minute. Kind of like that saying, once you see it, you can't unsee it. So I feel like I just notice the crashes more now that I actually know that I'm having crashes and that I'm not like just dissociating or whatever. And it's honestly kind of funny, just like how once I left my abuse situation, I wasn't being gaslit anymore about the issues I had, and I was around people that were telling me that I'm not supposed to have all the issues I have, and I'm not supposed to be in pain all the time, and all that different stuff. I noticed how like not okay my health was after I stopped being gaslit about it. And I was really able to see that I really wasn't doing too well. I think it's like that, so I can't even really say if it's really getting worse or if I just feel like it's gotten worse since I've been on the East Coast because I've been noticing more now that I'm actually paying attention to it. It's like, even though I was in way worse constant pain when I was like in my abuse situation, it's like it still feels like I was better than because I was being gaslit so much about it and being told that like it was okay to have like no blood, red or white, and different things like that. It just seems like I was better then, if it makes sense. But yeah, it's definitely too long for me to like read that thing I typed up that I was gonna read at this point. But yeah, so anyway, no, I didn't even finish. So the last thing, no, did I finish? I think I did actually. I think the last point I was making is that in every situation I'm in, there's a new excuse for medical gaslighting. So like when I was in my abuse situation, the doctors could say, well, it's because of abuse and you're just stressed out, or your mom's just lying or whatever. But now that I'm homeless, they could like say, they could accuse me of being on drugs or accuse me of being like insane and not in my health getting bad because I wasn't taking care of my health because I'm homeless. Or they could just say, well, maybe you're just not eating enough because you're homeless. Or maybe you're just stressed out because you're homeless and different things like that. And oh yeah, I do remember something else I could say though. The nurse also mentioned like how maybe I had proteinuria because I wasn't eating enough protein or I wasn't eating enough in general. Because of course they're gonna try to do the whole, well, maybe you're just not eating thing. Like I just been sitting around starving myself for like for like I don't know how many years has it been, or at least how many years has it been since I've been severely underweight. I could say that. Because that's another thing too. Doctors can't use all the different like gimmicks or manipulation that they use on other people with me. Because like when you have issues like I have and you're obese or whatever, they could say, well, if you just stop eating so much and you just lose some weight. But they can't do that with me. So they either have to say, well, I mean, I don't know. I mean, you seem fine to me because you're small and you know you're not obese, so I mean, I don't know. Or they could do the whole, well, maybe you just been starving yourself thing, which honestly isn't really that different from when they said that, from when other doctors said they just felt like I was being starved at home, but didn't do anything because they didn't care. That's the usual mandated reporter. Just like with the molestation accusations when I had the pelvic floor dysfunction. In fact, I remember even this one staff member from this placement, the Jim Crow self-confined placement for quote-unquote bad black kids that I was in. This one staff member who technically didn't work for them but worked around there, long story, was like, well, you know, if you have pelvic floor dysfunction, that usually comes from like anal sex, and so, you know, I mean, you've been getting sodomized even if you don't remember it. And it's like, so you're telling me that I'm getting sodomized, but you're not going to do anything as a quote-unquote mandated reporter because you really don't care and don't want to get involved. And I haven't been getting sodomized anyway, luckily. Honestly, it's a good thing that a lot of the things that they were saying weren't true. Like, luckily, I wasn't pregnant with an STD. I don't even think I could get pregnant, to be honest. Like, really. Like, I highly doubt that I can get pregnant. But, yeah, I don't know. There's just so much I could say about it. But it kind of goes back to something I've been realizing with the medical system, and it's like, it's really hard to get a diagnosis or to get anything put on paper when it's not being used to take advantage of you in some way. That's what I've noticed a lot. And what was the other thing I could say? This is like really long. I gotta stop recording real soon. It was something else that I'm forgetting. I don't even really remember what I was gonna say. It might have been this, but I don't know. I just know I wanted to say this too. And I've mentioned this in another video, I think. I wouldn't even want to be thrown on any of their meds anyway. I'd rather just continue to treat myself because, for one, I mean, I feel like that would be my only option regardless, because I don't really see myself ever getting like any diagnosis put on paper, and I'd rather not, because then like you come into agreement with it and then you're stuck there, and then they're telling you have 5 months to live and stuff like that. But I don't really see myself getting one anyway, just because of how like these people operate. But overall, the only thing that they're gonna do is like throw me on insulin and those other drugs, and it's like, once somebody starts taking insulin, it's pretty much over. Then their body gets addicted or dependent on insulin, and then they end up having to ration for insulin because they can't afford it. And then they end up dying, and I wouldn't want to do that because that's gonna mess me up even worse. And of course, if it wasn't for these people's drugs, I wouldn't even be in the position that I've been in. And it's like, all of a sudden now you guys want to do something. And yes, you guys, because it's really hard for me to see all these people any different. It's like the same mess. And I don't know what else to say. Pretty much it's like, it's just so many risks. It's so many risks with like going these people about anything. Because like I said, I can't talk about why I got it. Oh yeah, I remember what I was forgetting. Which I didn't actually finish this sentence because I completely forgot. So, the lady said the whole eat more protein or eat more in general, because of course they're gonna like act like I just haven't been eating or something maybe, and that's why my blood sugar was at 55. And I mean, I can't necessarily say that they were just doing the whole starvation, infectious disorder accusation, but I can definitely say that at least they were trying to accuse me of like maybe just not being able to like eat because I've been homeless. Like, there aren't soup kitchens or something, but they were at least doing that little accusation. And oh yeah, I remember what I was gonna say too. When my IC flare had came back, because I haven't had IC symptoms since I was living with relatives in the mold toxicity, which I didn't just have like IC bladder pain, then I had like full blown pelvic floor dysfunction, because like I said, I also had spastic colon and a whole bunch of other symptoms that I now actually know the names of. But I haven't had IC in years. But once I tried the carnivore diet for the little 7 days I did, and my blood sugar obviously dropped like really, really low, as I now know the symptoms of low blood sugar. I don't really think the whole eating a lot of protein thing will even go well for me anymore, because like just 8 days in, or even less than that, I went into an IC flare when trying to do the carnivore diet. And I don't even really know if it was just because of the protein. I also think it was because since I wasn't eating anything with sugar in it, like my blood sugar was too low for my body to really function. And also, like I mentioned before, I really can't digest protein or fat anywhere, or at least I couldn't. I probably can now, because I've been on the HCL for a while. But I also know that like bile is supposed to play a role in that, and I don't really know how my bile situation is. I do know that like I have low liver function. I mean, it's not, none of it's like really bad. I know I have low alkaline phosphatase, and for my kidney health, I know I have proteinuria. And honestly, I don't know if I've been had it and it's just been ongoing, But I do know that I'm pretty sure that's what's been causing the interstitial cystitis bladder pain. But I also think that it has something to do with my blood sugar drops too, which going back to what I was saying, I can't really say that it's just like, I don't even know how to explain it, but it just seems like eating a lot of protein just isn't going well for me. But I can also say that after I eat or drink anything, I have IC type symptoms now. And the funny thing is, when the flare had started, those however many months ago, probably even before November, when I tried the carnivore for 7-8 days, when it started, I don't even remember what I was about to say. Oh my gosh. Okay, I think I was gonna say when it started, it lasted for a good minute, but like after I got off carnivore for like about for 8+ days, it went away. But then it eventually came back, and since then it's just been ongoing. And I think this also, not I think this also goes into like this other thought process I have because of all the like neglected medical gaslighting I went through, where I used to just have this idea that like if I just keep ignoring things and just walk it off, all the symptoms and issues I've been having going on for some years, especially, well, some since the drugs, but some of the issues got worse or more noticeable after getting off the drugs. But I just like was pretty much brainwashed into thinking that I could just walk things off. And I feel like I also still have this like walk things off idea, which I did have for a while until I really started working on my health. And it's like, I don't know, I just thought that like the proteinuria, or at least the IC flares, would go away, but it's like they did for a little bit, but then they came back, and it's like I still have them, just like with the back pain and other issues that I've been having. And so then there's this one last thing I could say, which is also that I haven't had blood work again or urine analysis again in a while. So I definitely am still having like the constant IC symptoms. But I'm not even really sure if I still have proteinuria right now. Because the funny thing is, the day that I went in and got tested, I got a couple different tests that day, but when I went in and got tested, I wasn't even in pain, at least in that moment. I don't even think I had been in pain or having the IC bladder pain all day. But that's when my test came back and it said that I had proteinuria. And it was really interesting. It kind of reminds me of how, like, sometimes when I'm in the most pain and I check my blood sugar, it's not even low. And I guess I just get in pain when it's getting low. Because sometimes when I check my blood sugar and it's actually, like, really low, I'm not in pain. But sometimes I'm, like, in a lot of pain. Which goes into this other thing that I've realized, which is that the leftover stomach pain that I do have happens when my blood sugar is low, which is related to a couple different things with like my digestive system not really being able to function because it doesn't have like enough energy or fuel. But I also now know that along with the low stomach acid and probably also low digestive enzymes, before I started working on my digestion, I probably have also had diabetic gastroparesis. And of course, you know, like if you were to go to doctors mentioning these things, but you have nothing put on paper, nothing in a file somewhere, they're gonna try to act like you have factitious disorder. But honestly, I've even seen situations where somebody does have a diagnosis, but one doctor will be like, "Nah, I don't believe that. I refuse to believe that." Kind of like this whole situation where when I started, when I found out about that homeless doctor, and I wanted to like see how true the whole getting starved at home or stress thing was. Once I left my situation, after a few months, well, after I found the homeless doctor, I decided to go there and do the whole thing I had to do where I lied about my age and all that. And I was like, I should go get blood work and stuff done and see if, like, I'm still quote unquote malnourished and all those different things. And then the doctor obviously didn't order all the stuff he was supposed to order, claimed he did order, because he was like, Well, I mean, I don't really believe or think you're malnourished, and I would love to know who's telling you all those things. Which also kind of reminds me of this other doctor that was like, well, I mean, I was really skinny when I was younger. And then that's another thing, too. Some people try to act like maybe I just, like, I don't know, I'm too self aware or something, as if you're supposed to be severely underweight. But honestly, I've never actually cared about weight or any of that stuff. It took me years to actually realize that, like, I was as underweight as people have been telling me I am, would constantly get in situations where people don't believe I'm older than like 10 and things like that, or 11, which honestly I still like feel like people are just overreacting. But it just took years of people's different remarks for me to actually really think about how I may possibly look. But at the end of the day, that's still kind of irrelevant, that being looks, because I mean, I still am in pain all the time. And that's like what matters more to me is like fixing the pain. Because for one, when you're healing, one of the ways you know you're healing is because pain starts to go away. And honestly, pain going away would probably come first before being able to gain weight in my healing process, I would believe. Just like with me working on my digestion and me knowing that I was getting better, because for months now I no longer feel the feeling I used to have constantly for years on end of like having bacteria going to war and having celebrations and bar mitzvahs and fights in my stomach, because that's how I used to feel pretty much. I would be in severe pain after eating, and even on an empty stomach I'd be in pain and just a lot of pain, and that was because I couldn't digest food because I didn't have enough stomach acid. It may have had low digestive enzymes, although I don't really have a way of proving that I did. It's like obviously I had low stomach acid because once I started taking the butane HCl, I was able to like digest things. And after some months of taking that, I no longer was having diarrhea and seeing undigested food unless I ate like vegetables or fruits, which that kind of still happens, even with the digestive enzymes. So I don't really know a way of really knowing if I need the digestive enzymes, although after I'd already been taking the digestive enzymes for months, I did order amylase and lipase test anyway. And I did stop taking the digestive enzymes for a little while in hopes of like getting more accurate results. And surprisingly enough, I didn't see low lipase because that's one of the tests I got. Well, there's only two you can get when it comes to like pancreatic enzymes, lipase and amylase. I had elevated amylase, which I'm not really sure what that means exactly, but I'm sure that there's signs of like pancreas issues. And I had my lipase said it was normal, but I find that hard to believe because I definitely can't digest fat, which is one of the issues I ran into when doing carnivore again, because I hadn't had orange diarrhea in a long time. But if you have like orange stool or floating stool or orange diarrhea, that's actually fat, orange or yellow. But yeah, and also going back to the protein and urea, I may have mentioned this before. I'm not really sure if not being able to digest protein would really correlate, because I know I really can't, or at least I couldn't, but I'm not really sure how much that correlates to proteinuria. I'm not really sure how much like the digestion of protein has something to do with the kidneys, and like if you can't digest it, it would just go through the kidneys. I don't really think that's how that works, but then again, it could be, because I do know when I was doing research and like reading about it, a lot of protein can just end up in the kidneys regardless. So I guess it could correlate, but still, like I said, it seems like when my blood sugar gets low, my kidneys aren't able to like really filter all that stuff. And hopefully this makes sense, but that's what it seems like to me. So yeah, some nurses had asked me how I've been walking around with 55 and lower blood sugars and am not on meds and don't have a diagnosis, which like I said, I mean, the diagnosis could possibly help with like disability housing, but they want to keep you in a bubble anyway when you have stuff like that. And even then, it's like, due to my age, like, I mean, I probably still wouldn't be able to get into that because they're usually like retirement homes almost, and they're for people that are 60. So it's like they usually don't even let people who are like teenagers or into those types of things. I mean, 60 is like a long way away. They don't even usually let people that are 40 or 50 into things like that. Because, like I think I've already said, disability housing is commonly for elderly people. And also, another thing with that is that if I was to, like, I don't know, get a voucher or something in an area like this, which you're about to do away with affordable housing anyway. But if I was to get something like that in an area like this, I'd be in the hood anyway, and then that's a whole nother issue. But I also don't like how they wanna like bogart you for making money, and then like once you do settle down, because you finally like have a place and you're able to like get a job and all those different things, because you're able to like have somewhere to put your stuff and actually sleep. Then they're ready to kick you out, or maybe even accuse you of fraud or something, which, like I said, I wouldn't want the SSI and I can't get that anyway, so I still have to work somewhere somehow. But it's like, once I'm able to work, the disability housing or affordable housing in general, just like they want to keep you in like a victim type situation. And this is way longer than it's supposed to be. But yeah, so there was that. And it's honestly just so annoying how these systems work.